Dr. Randeep Guleria, the Director of the All India Institute of Medical Science, is joining us on NDTV this evening. Dr. Guleria, thanks very much for speaking to us. We turn to you in these difficult times for some answers, Dr. Guleria. To begin with, sir, at what stage is India, when you look at the numbers and the steadily rising graph of cases, which I suppose would be expected as you also test more, but where are we exactly in terms of the transmission stage? Has community transmission, in other words, started?
So in my mind, there are in India there are certain pockets, the so-called hotspots, where there is a suspicion that there may be some community transmission, because there are a number of cases there has really increased significantly, and in these hotspots we need to be very vigilant and really look for community transmission, because that is where the community transmission will start if it has not started already, and therefore we need to be very careful. At a national level, I don't think we have a large scale community transmission, but at a local level we need to be very, very vigilant, because as the number of cases are rising, it indirectly is pointing towards the fact that there may be a localized community transmission in these areas, and we need to clamp on that. We need to have a very aggressive lockdown and prevent that transmission from becoming more diffuse or more general.
Just to tell our viewers, community transmission is when you really cannot trace back where the person may have contracted the virus from. Till now, we're looking at people who may have traveled themselves or been in contact with somebody who has traveled somewhere. But if you don't know the source, then it's community transmission, and it just multiplies from there.
Correct.
But Dr. Guleria, how do you though see the overall trajectory of the way things are taking place in India? Because we had the first case way back at the end of January, and we are at just over 4,000 cases right now, and the number of fatalities is just over 100 at this point. Now, when you look at those numbers, would you say that all things considered, India is so far all right under the circumstances?
So I think under the circumstances, considering our population, the numbers that we have, we still have done fairly well. Some people argue that maybe we are missing a number of cases, but I think even if you look at the surveillance data, the IDSP surveillance data, which looks at ILI, that is influenza-like illness, or SARI, that is severe acute respiratory illness, there's really been no spike in the number of such cases across the country, suggesting that there may be an increased number that we're missing out on. But having said that, the pandemic pans out differently in different parts of the world, and we need to be very vigilant, because whatever the effects of the lockdown that we're going to see are going to be evident over the next few days. It's usually a 14-day that we have to wait for the effect to start, because a lot of transmission that happened before the lockdown will also show its effect now. So we need to see what happens over the next 4 to 5 days, and if this number keeps on rising, then it's a cause of concern. If it tends to flatten out and the curve starts sort of flattening in terms of the number of cases, and the doubling of the cases starts taking a longer time, we may still be able to have lesser number of cases, and our health resources may not be that much strained.
So what you're saying is that currently we are doubling cases at about every 4 days, and if that extends to say every 7 days over the next week, 10 days, that would satisfy you that we are flattening the curve. Is that what you're saying?
Correct. So if we find, say, by the 10th or 12th that our doubling time starts increasing, and if it's even more than 5 to 6 days, that will be more satisfying that the lockdown has worked to some extent when we've been able to flatten it. The curve has not risen as sharply as it did in Italy, Spain, or the US, so I think we're lucky as far as that is concerned. But I think it's time to be more vigilant, because there has been an increase in number of cases over the last few days.
Dr. Guleria, then that comes to the point about the lockdown itself, because we aren't very clear about how things will pan out after the 14th of April. There seem to be suggestions that there may be parts of the country which may see a gradual easing back into a pre-lockdown situation, but the hotspots, those areas where there are a large number of cases, those may have to continue maybe for a couple of weeks more, maybe longer. Would you say that that is the most pragmatic way to go forward? We've heard the Telangana Chief Minister today, in fact, say that the current lockdown, the national lockdown, should go on for 2 more weeks. What are you personally in favor of? What would you advise?
So I think what we need to do is look at the data, and the data will become more clear, I would say around the 10th or 12th of April, and that will give us an idea. But I do agree with you that if we have hotspots where our doubling time is very short and we have a number of cases there, lifting the lockdown there may not be possible or may not be a good idea. But on the other hand, we need to take a call on other areas which are not hotspots or there are very few cases, and whether it would be a pragmatic view to see whether a partial lifting can be done there. But I think everything needs to be balanced out. It also needs to, one needs to see how it's affecting the economy, how is it affecting the local man, the laborers. So I think a detailed discussion and weighing the pros and cons needs to be done, but we need more data which should come after the 10th of April.
But the other concern, Dr. Guleria, is that, or I think, and this is happening in many countries around the world, is that you can have very strict lockdowns like the one you have in India or some other countries, but the moment you begin lifting them, then there is a concern that the infection or the virus will come back, maybe not now, but somewhere down the road. So do you think we're looking at possibly over the next few months a situation where there might have to be, another lockdown somewhere down the road for a couple of weeks, 3 weeks, really depending on how the situation pans out until you have a vaccine in place?
Correct. So even if you look at what happened in Singapore, they lifted the lockdown and then it came back again. It will depend on how things or how cases emerge over the next few weeks or months. But this virus is there to stay. It's not that we are working on a strategy that will eliminate the virus totally. What we're doing is two things. One is we're flattening the curve so that there are not a huge number of cases at a given point in time, and therefore it's easy to manage them, and very easy. And the issue is of managing the high risk group and the elderly, because that's where the mortality is highest, and to work on strategies of how we can protect them from getting infected. The second part is that if the longer we are able to delay it, the more likely that we'll get effective drugs which are going to work and which we can treat and start giving even at a large scale, and we may even have a vaccine at some point in time which would really help us to protect the high risk groups and by vaccinating them. So I think what we're trying to do is have a prolonged period of less number of cases, but I do agree with you that the lockdown cannot go on indefinitely, and one will have to look at different strategies at different points in time.
Dr. Guleria, then how important will these antibody tests be? Because we understand that is going to be rolled out in the next few days, and in some countries they're talking about doing these tests to then literally see who among the population have developed immunity to this virus and therefore can return to the workplace. Now again, from what I read, there's confusion about whether people actually will have immunity for a long period of time against this virus. We just don't have that data yet. So how much will these antibody tests help, which we are expecting should start in the next few days?
So I think it's very important for people to understand what is the antibody test, what are the advantages and what are the disadvantages. The advantages of the antibody test is it's a point of care test. You just have at the site that you get yourself tested, you give a drop of blood, you put it onto a strip, and by looking at the change in color or whether a line develops or not, you can say whether one has the antibodies or not. But the important thing to recognize is that it's not a diagnostic test per se in the early days. So when you have the infection, if an individual develops infection by COVID-19, his throat swab will be positive early. That is, the virus is present in the throat, and you can detect it by the traditional RT-PCR test that we're doing nowadays. But after about 5 to 7 days, the body's immune system starts producing antibodies to fight the virus, and that's when the antibodies come into the blood, and that's when the antibody test is positive. So it's not going to be positive in the first 5 to 7 days, and if you were to test someone at that point in time, he may be infectious, his RT-PCR test would be positive, but the antibody test would be negative. Secondly, then you have a period where both the antibody test and the throat swab is positive. That will last for a few days, and then once the person becomes all right, the throat swab becomes negative, and the antibody test remains positive even after you become all right. So a positive antibody test does not really tell you that you have a recent infection unless you have symptoms. It could be a past infection also. The advantage also is that, like you said, there is some data that you could use a person who is recovered, his own blood, which is known as convalescent plasma, as a form of treatment. Because if you take his plasma and he donates his blood, That plasma also has the antibodies which can fight this virus, and if you give it to a sick patient, you may use this as a form of treatment. So that is also something which is being looked at as a form of treatment. It was even used during the Ebola outbreak, that convalescent plasma for people who recovered was given to patients with reasonably good outcome. Secondly, like you said, these people can go back to work. But the only issue here is we are not very sure how long does this immunity last.
Exactly.
And does it last for a sufficient long period of time, or can you again get reinfected with the virus? I think we need more data as regards this.
Well, 2 or 3 quick fire questions, Dr. Guleria, before we let you go. One is that we now have this advisory to wear masks whenever we go out. Is it okay to just wear a scarf to cover your mouth, because we don't want to hoard on the medical masks that healthcare professionals need? So what should people cover their faces with if they do have to go out to buy essentials, or people like us who come to the office?
So I think it's important to understand the difference between the two, mask and the face cover that we call it. The mask could be an N95 mask or a AAA surgical mask, which I think is for healthcare workers and not for the common man. And they should not use it, because you are actually then depriving a healthcare worker of a protective equipment which he needs so that he doesn't get the infection. What one can use is, like you said, a scarf, a handkerchief, or you could even make a cloth face cover at home. There's a lot of that on the internet of how to do that. How does it help? So we also know that there are a number of individuals who may be asymptomatic but may have the virus in their throat, and they may give it to others. The cloth mask actually prevents that person from causing the virus to come out into the environment to a large extent. It acts as a filter, and the dissemination of the virus by that individual is stopped. So if everyone wears a cloth mask, then those who have mild infection or who are asymptomatic but have infection will not give it to others, because of the fact that the mask itself will provide some protection and not allow the virus, the droplets, to travel very far. So wearing a mask actually in a person who has a problem or who may have a mild cough protects others, and therefore it may not be a bad idea for everyone to wear a mask. The important thing is that you wash your mask properly. You could even wash it with soap and water or within a washing machine, and you should wash your hands regularly when you're touching the mask or putting it on or taking it off.
Finally, Dr. Guleria, is it safe to order a pizza?
So again, it's very safe to order a pizza. The pizza itself is made at a very high temperature, and it's all right. Some people are worried about the case, the wooden packet, the cardboard pack in which the pizza comes in. And what if you could do is that you could use a simple antiseptic or a hand wash on a piece of handkerchief and clean the outer part if you're very concerned, and then once it's cleaned, you're safe that if someone has touched it and may have the infection, the virus will die. But otherwise, it's by and large very safe. So don't worry about the pickups that you take or the other courier things that come. They're pretty safe.
Finally, Dr. Guleria, just before you go, I know this is a bad time, and we're seeing a number of fatalities all over the world. There's so much depressing news that's coming in every day. But can I ask you, do you see some hope? Do you see some light at the end of this long tunnel? I know it's a tough fight, and you're saying we have to be vigilant. But if you had to give us some message of looking ahead, some positivity, what can we take heart from at this point?
So I think we need to take heart from previous pandemics that we've had. We've had a pandemic about more than 100 years ago in 1918, which affected India also in a large way. As a matter of fact, in the 1918 pandemic, more people died because of the pandemic than because of the World War. But the world came out of it and came out stronger. And I think now we are better prepared. We have more information, technology is there, science is there. Therefore, our preparedness for a pandemic is much better. It's better than ever before. Of course, we have the disadvantage that people travel more rapidly and viruses spread more rapidly, as has happened with this. But I think at the end of the day, we will find that we will come out stronger as far as this pandemic is concerned. But I also do agree that our lives will change totally, that we will have a new normal, because what will happen post-pandemic is that in many ways, our life as we live it today may change significantly.
I think you're right, Dr. Guleria. Thanks very much for joining us. I know you're busy, you have a lot to deal with right now, but we really appreciate you taking the time and speaking to us, Dr. Guleria. Thanks very much indeed.